Great. Good morning, everyone. Firstly, wishing everyone a very happy World Physiotherapy Day. A warm welcome to all our participants and our audience members to the PhysioBrain quiz. I am Dr. Shivani Sutke, and I'll be your physio quiz master for today's events. We all are at an exciting session where all our participants will showcase their knowledge and skill in the field of physiotherapy. Recalling our pre-qualifiers, in the pre-qualifiers, we had 20 teams competing, where four of our teams, that is, team from Royal College of Physiotherapy, team from Dhole Patil College of Physiotherapy, team from MGM School of Physiotherapy, and team from Sancheti College of Physiotherapy qualified for the finale. As we observe the World Physiotherapy Day, this quiz is a way to honor the incredible work and contributions of physiotherapists around the globe. It's a day to recognize the essential role that physiotherapy plays in improving our health and well-being. So let's all of us cheer our budding physiotherapists as they demonstrate the depth of their knowledge in physiotherapy. I'm sure all of you all are excited for today's enlightening experience. Before we begin, let's just look over the rules and format of the quiz to ensure that we have a smooth and a fair competition. I hope all of you guys are geared up for today. Just give me a thumbs up. Great. So I request Team Royal College of Physiotherapy to choose from 1 to 4 any number.
Three.
Sorry?
Three.
3. Okay, great. I request Sancheti College of Physiotherapy to kindly choose one number except 3 from 1, 2, and 4.
Four.
4. I request MGM School of Physiotherapy to choose from the remaining 2 numbers.
2.
Sorry?
2.
2. Okay, great. So, as you can see on the screen, kindly rename your teams as per the number being allotted. So you may have to leave the meeting and rename yourself and join back for the meeting. Okay, so before starting, the joy of competition is in the process of learning and not in the outcomes. So let's make the most out of this opportunity. All the best to all the 4 teams. So coming to our first round is anatomy of answers. Talking about rules, each team will get 20 seconds to answer after the question is read out. The correct response will fetch you 10 points, and incorrect or when the time is up will fetch you 0 points. The decision of the quiz masters will be considered to be the final decision. Kindly answer only when the question is asked to your particular team. So the first round, we have no eliminations. In the second round, post the second round, 2 teams will be eliminated. After which, for the final round, we'll be having 2 teams competing for the final round. Any doubts? You may unmute yourself and ask if any.
No, ma'am.
Okay, let's move forward. So the first question is for Team A, requesting Team A to kindly unmute yourself.
Yes, ma'am.
Are you all ready? Are you all ready, Team A? Okay. Your first question is, which of the following is an example of non-probability sampling method? Your options are simple random sampling, stratified sampling, systematic sampling, or convenient sampling. And your time starts now.
Random to help.
Sorry?
No, no, you're not answering. Just discuss.
Okay.
Answer is
Yeah, the clock is ticking.
hello.
Yeah, the answer is
The convenient sampling.
That's absolutely right. That has fetched you 10 points. Congratulations. Requesting team A to kindly mute yourself and team B to kindly unmute yourself. Team B, are you all ready?
Yes, ma'am.
Your question is, what is sampling error in the context of research? The error, your options are the error that occurs when the sample is not random. B, the difference between the sample estimate and the true population parameter, the error that results from using too large a sample, and the mistake made during data collection. Your time has started.
Option D. Mistake made during data collection. Option D.
That's the wrong answer. The right answer is the difference between the sample estimate and the true population parameter. No problem. Requesting team B to kindly mute yourself and team C to unmute yourself.
Yes,
ma'am.
Team C, your question is, why is random sampling often preferred in research studies? Your options are A, it ensures the study is less expensive to conduct. B, it guarantees that the sample is exactly representative of the population. C, it reduces the selection bias, leading to more generalized randomization. D, it requires less time and effort than the other sampling techniques. Your time has started.
ma'am.
Yes.
The answer is C. It reduces the selection bias, leading to more
Absolutely
generalized
right. That has fetched you 10 points. Congratulations. Requesting Team C to kindly mute yourself and Team D to unmute yourself. Team D, are you all ready?
Yes.
Yes. Your question is, the following picture represents which type of sampling? Your options are A, systematic sampling, B, convenient sampling, C, cluster sampling, and D, stratified sampling. Time is clicking. Time up. And the right answer is option A, systematic sampling. No problem. We'll move forward to the next set of questions, requesting Team A to kindly unmute yourself and Team D to mute yourself. Team A, are you all ready? Team A?
Yes, ma'am. Yes, ma'am.
Yes. Your question is, which study design is generally considered the highest level of evidence in the hierarchy of research? Your options are case report, cohort study, systematic review, and cross-section study. Your time has started. Team A, 5 seconds.
C. Systematic review.
Absolutely right. That has fetched you 10 points. Congratulations. Coming to Team B. Team B, kindly unmute yourself. Team A, mute yourself.
Yes, ma'am.
Your question is, which of the following study design involves the researcher actively intervening to apply a treatment or exposure? Your options are A, case control study, B, cohort study, C, randomized control trials or RCTs, or D, cross-sectional study.
Randomized control trial.
Absolutely right. That has fetched you 10 points. Congratulations. Coming to Team C. Team C, kindly unmute yourself and Team B, kindly mute yourself.
Yes, ma'am.
Your question is, a group of researchers is interested in studying the relationship between smoking and lung cancer. They select a group of individuals who have lung cancer and another group who do not have lung cancer. The researchers then look into the smoking history of both the groups to determine if there is a higher prevalence of smoking among those with lung cancer compared to those without. Which type of observational study design are the researchers using in this particular scenario? Your options are A, cohort study, B, cross-sectional study, C, case control study, and D, ecological study. Applying, your time is clicking. 5 seconds more.
Ma'am, the answer is cross-sectional studies.
Your time was up. I'm so sorry, but that is the right answer. It
Ma'am, the
has-
answer is cross-sectional studies.
the answer is case control study. I think you said the wrong answer. Okay. But anyways, the time was up. No problem. We'll move to team D. Team D, kindly unmute yourself.
Yes, ma'am.
Your question is, what does level 2 represent in the following level of evidence pyramid? Your options are A, case control study, B, case series and case report, C, expert opinion, or D, cross-section study. Your clock is ticking. 10 seconds.
Case series and case reports.
No, that's the wrong answer. The right answer is A, case control studies. No problem. Requesting team D to kindly make sure that all of your participants are visible on the screen. I cannot see participant number 1. This is the first warning given to team D. Okay. Moving ahead, requesting team A to kindly unmute yourself and team D to kindly mute yourself. Team A, are you all ready?
Yes, ma'am.
Yes. Your question is, a conflict of interest in research occurs when your options are A, a researcher is paid to conduct the study, B, the researcher has a personal financial interest in the outcome, C, the study results are positive, and D, the participants have differing opinion about the study. And your time has started.
The answer is D. Participants having different opinions about the study.
That's the wrong answer. The right answer is B, the researchers had personal or financial interest in the outcome. No problem. We'll move to team B. Team B, kindly unmute yourself.
Yes, ma'am.
The question is, before beginning a research study involving human participants, what must researchers typically obtain? Your options are A, informed consent from all the participants, B, ethical approval from the review board, C, a guarantee of publication from a journal, D, funding from the sponsoring organization. Your time has started.
Ethical approval from the review board.
Absolutely right. That has fetched you 10 points. Congratulations. Coming to team C, kindly unmute yourself, and team B, kindly mute yourself.
Yes, ma'am.
Team C, your question is, plagiarism in research refers to A, conducting a study similar to one previously conducted, B, using someone else's work or ideas without proper attribute, C, repeating an experiment multiple times, D, publishing a paper in multiple journals. Team C,
Ma'am, option B, using someone else's work or idea without proper attribution.
absolutely right. That has fetched you 10 points.
Thank you, ma'am.
Congratulations. Moving to team D.
Yes,
Team D.
Yes, ma'am.
Team D, participant number 1 is still not visible. I request you all to kindly accommodate yourself in a way that every participant is visible. Yes, this works. Okay, your question is, which factor is crucial to ensure that participants understand the information provided in the informed consent process? Your options are A, using complex legal language, B, providing information in a language and at a reading level appropriate for the participants, D, requiring participants to sign without reading the consent form, D, rushing through the consent process to save time. Your time has started.
Ma'am, option B, providing information in a language and at a reading level appropriate for the participants.
Absolutely right. That has fetched you 10 points. Congratulations. So with this, we are done with the first round. That is a round anatomy of answers. Coming to scores, Team A is at 20 points. Congratulations, Team A. Team B is also at 20 points. Congratulations, Team B. Team C is again at 20 points. Congratulations, Team C. And Team D is at 10 points. Team D has to get up. So coming to the next round is our Mind Maze Challenge. In the Mind Maze Challenge, you have to answer the questions being displayed. You will be shown a case scenario where we'll be asking you two questions. You will be having 45 seconds to answer both the questions. Correct response to both the questions will fetch you 10 points. Correct response to one question will fetch you 5 points. Incorrect response, or when the time is up, you will be getting 0 points. Decision of the quiz master will be considered to be the final decision. Also, kindly answer only when the question is being asked to your teams. Any doubts in the rules? You can unmute yourself and let me know if you all have any doubts.
No, ma'am.
Great. So a gentle reminder that after this round, we will be eliminating two teams. So after that, we'll be getting only two teams for the finale. Fine. So the first case scenario will be directed to Team A. Requesting Team A to kindly unmute yourself.
Yes, ma'am.
Yeah. So your question is, a 45-year-old patient with a transfemoral amputation is ready for gait training with the prosthesis. The physiotherapist notices that the patient has a hip flexion contracture on the affected side. Your first question is, how would this contracture most likely affect the patient's gait with the prosthesis? And the second question is, which orthosis suits the best for the patient? And your time has started.
Reflection.
Team A, the clock is ticking. You may discuss and let me know the answer.
The second answer is hip, knee, ankle, foot orthosis. And for
Can you be a bit loud?
the second answer is hip, knee, ankle, foot orthosis.
That's the wrong answer. And the answer to the first question.
The patient will not be able to
Your
extend.
time is up. Sorry, Team A, but this question has not fetched you any marks. No problem. Moving to Team B. Team B, are you all ready?
Yes, ma'am.
Okay. Your question is, a 20-year-old man, while crossing a road and sustained a pronation eversion injury to his left ankle. He complained of severe pain immediately in his ankle. Assessment of movement reveals pain at the ankle dorsiflexion and plantar flexion with extreme apprehension and reluctance. He is unable to fully weight bear on the left ankle owing to pain. A radiograph of the ankle is shown below. What is the diagnosis seen? And your second question is, name the classification used for the diagnosis. And your time has started. Team B.
Yes, ma'am. Fracture of the
Team B, your clock is ticking.
Yes, ma'am. Is it the deltoid rupture which has led to the diagnosis?
15 seconds more.
Fracture of fibular distal end, talus and condyle talus along with tibial and condyle.
That's absolutely right. It's a fracture of fibula. And question B, time up. So this question has fetched you 5 points. No problem. We'll move to Team C. Team C, kindly unmute yourself.
Yes, ma'am. Yes, ma'am.
Your question is, A 65-year-old male patient with 40-year history of smoking presents to the clinic with chronic shortness of breath, a persistent productive cough, and frequent exacerbation over the past year. Pulmonary function test reveals FEV1 by FVC ratio of 55% and a marked decrease in FEV1. His arterial blood gases show mild hypoxemia and hypercapnia. The patient reports difficulty in performing activities of daily living and often feels fatigued, even with minimal exertion. He has been prescribed bronchodilators and corticosteroids but reports only partial relief. The questions are: first, which specific physiological mechanisms has likely led to the patient's decreased FEV1 and how do these mechanisms contribute to his symptoms? Your second question is: which specific aspects of pulmonary rehab program would be most beneficial for improving the patient's exercise tolerance and might be particularly challenging to implement in his case? And your time has started. Team C, your clock is ticking.
Physiological mechanism decreased COPD.
You have 15 seconds. Team C.
Ma'am, the physiological mechanisms for reduced FEV1 is due to obstruction. Air is trapped inside the lung, as in the
Absolutely
COPD.
right. Absolutely right for
And
the first question.
specific, we will emphasize
your
on
time
rehabilitation
is
of
up
expiratory
for-
exercises.
Your
PEP
time
devices.
is up for the second question. So that this question has fetched you 5 points. No problem. Coming to team D, the correct answer is airflow obstruction for A, and for B it is endurance training. You were very close. No problem. Coming to team D, kindly unmute yourself.
Yes, ma'am.
The question is: Sarah is a 52-year-old office manager who has a history of shoulder pain from the past 6 months, which she attributes to repetitive overhead activities at work. She has not had any recent trauma or injury to the shoulder. She reports difficulty lifting her arm above shoulder height and experience pain during sleep. Current symptoms are pain in the shoulder, especially during overhead activities, weakness in shoulder abduction and external rotation, limited range of motion in shoulder abduction and external rotation, pain that worsens with activity and improves with rest, difficulty in sleeping on the affected side. The two questions: the first question is, what is the diagnosis? And the second question is, what is the gold standard radiographic investigations done for the above condition?
Ma'am, answer of the first question is frozen shoulder or adhesive capsulitis.
That's the and the second question. The time is clicking.
Excellent. Radiographic
You have 15 seconds.
Good. Ma'am, the gold standard radiographic investigation is X-ray because it shows degenerative changes.
Both team D, both of your answers are wrong. The first question is the diagnosis is of partial RC tear. And the second question, the gold standard radiographic investigation is MRI. That has fetched you 0 points. No problem. Coming to team A, kindly unmute yourself.
Yes, ma'am.
Team A, are you all ready?
Yes, ma'am.
The question is: a 68-year-old patient presents with sudden loss of vision in the right half of their visual field in both eyes. They are also having trouble recognizing familiar faces. He also reports experiencing painful sensations on the left side of their body, which are not proportional to any physical injury. Your questions are: what is the most likely diagnosis? And what is the underlying condition called? The clock is ticking, team A.
type diagnosis. Diagnosis is diabetes retinopathy.
Can you be a bit loud?
The answer is the diagnosis is diabetes retinopathy. And what is the underlying condition?
And for the second question,
10 seconds.
10 seconds.
Is
Time up, team A. So the answer is for question number 1, posterior cerebral artery infarct. And for question 2, it is thalamic pain syndrome. That has fetched you with 0 points. No problem. Coming to team B, kindly unmute yourself.
Yes, ma'am.
Your question is, a 50-year-old female patient with a history of hypertension, hyperlipidemia, and type 2 diabetes presents with recurrent chest pain on exertion. She describes the pain as a tight squeezing sensation that radiates to the left arm and jaw, and it is relieved by rest. A recent stress test was positive for ischemia, and coronary angiography revealed significant stenosis in the left anterior descending artery. She has been started with beta blockers, statins, and aspirin. Despite medication, her reports fatigue and short of breath during her daily activities. She is referred for cardiac rehabilitation to improve her functional capacity and quality of life. Your question is, which physiological changes in myocardial oxygen demand and supply likely likely causing the patient's symptoms? Question 2, what particular component of cardiac rehabilitation should be prioritized to address the patient's condition?
So
Your time has started.
hyperlipidemia causing plaque formation and hypertension causing hardening of the vessel. These two factors will not allow the adequate venomotor tone, and therefore there is a demand
Kindly-
supply mismatch.
Okay. And for second question,
Endurance training.
for your first question, it is linked to ischemia, and the second answer which you gave was endurance training. Can you be a bit more specific? Okay. So the first question's answer is ischemia, and the second question you have answered it very correctly. It is aerobic training. We can also call this endurance training. That has fetched you 5 points. Congratulations, team B. Team C, are you all ready? Team C,
Yes.
your question is, an IT worker reports lower back pain after working long shifts in a seated position at a computer workstation. A postural assessment reveals poor lumbar support and forward head posture. Which of the following adjustments would be the most appropriate to improve the worker's posture and reduce low back pain? Second question is, which assessment tool will you use to assess the working posture? And your time has started.
Ma'am, the assessment tool is we can use it work for REBA scale, and the adjustment is will provide the lumbar back support in a high seated chair with foot rest, and the screen should be at the appropriate eye level with keypad at the armrest and the in slight elbow flexion armrest.
Okay, you're absolutely right. That has fetched you 10 points. Congratulations, Team C. Okay, coming to Team D, kindly unmute yourself.
Yes, ma'am.
Your question is, a 6-year-old child is showing signs of poor motor coordination and difficulty with fine motor tasks such as writing and buttoning shirts. They also seem overly sensitive to touch and sound. What could be the underlying condition is your first question. Your second question is, what is the first line of physiotherapy strategy that might help? And your time has started. Team D.
Sir, ma'am, for the second question, the answer is coordination exercises, ma'am, to help with the fine motor task. And for first, sensitivity questions.
The clock is ticking. Time D. 15 seconds left. Sorry.
Whole time खत्म हो जाएगा.
You have 5 more seconds. Time
ADHD.
is up. Time is up, team D. The right answer is sensory processing disorder. The condition is sensory processing disorder. And the first line for physiotherapy strategy is sensory integration. No problem. So with this, we have completed our second round as well. So coming to the scoring, Team A is on 20 points. Congratulations, Team A. Team B is on 30 points. Congratulations, Team B. Team C is on 35 points. Congratulations, Team C. And Team D is on 10 points. Congratulations to Team D as well. So Team A with 20 points and Team D with 10 points will be eliminated after the second round. Both the teams did a great job with the quiz, but I would now request Team B as well as Team C to kindly gear up for the final round. Team A and Team D, you can be a part of the final round. We are more than happy to have you. So coming to the final round, that is the lightning round. So coming to the rules of the lightning round is a rapid fire round. Each team will be getting 90 seconds to answer. Correct response will fetch you 10 points. Incorrect response will fetch you 0 points. You can pass the questions. Decision of the quiz master is considered to be the final questions, will be the final decision. You all need to answer as quick as possible. Do not give any explanation for your answer. The answer could be in one word. Any doubts, Team B and Team C? You may unmute yourself and let me know. Should we move ahead? Team B and Team C ready?
Yes, ma'am.
Yes. We'll be getting 90 seconds. First, we'll be starting with Team B.
Yes, ma'am.
Team B, and your time has started. Which position is considered the position for gynecological procedures?
Pass.
Lithotomy position. Brain's ability to reorganize and form new neural connections is known as?
Neuroplasticity.
Right. Involuntary tightening or spasming of the muscles around the vagina is known as?
Pass.
Vaginismus. What does POMA stand for?
Mobility index assessment.
Wrong. Performance-oriented mobility assessment. Which of the following muscle fiber type would be more beneficial for a power lifter?
Type 2.
Absolutely right. During conventional resistance exercise, which of the following muscle fiber will atrophy first?
Type 2.
Right. Following retraining endurance athletes first notice a decline in maximum
Pass.
oxygen consumption. Which clinical finding is not indicative of ruptured Achilles tendon?
Pass.
Absent Achilles reflex. Under the RPWD Act 2016, what percentage of seats must be reserved for persons with disability in government jobs?
40%.
Wrong. 4%. During shock, the optimal position for which athlete is to be placed is?
Pass.
Pass. Reclining with feet higher than head. With this, your time is also up. Correct. Okay, moving to team C. Team C, are you ready?
Yes, ma'am.
Okay. And your time starts now. Which anatomical structure compensates for decreased oxygen level by increasing erythropoiesis?
Pass.
Erythropoietin. Which mechanism ensures that the blood flow increases to active muscles during exercise by passing less active regions?
Aerobic.
Sorry? Team C passed. It's rapid fire. Wrong. This is shunting. Medial winging of the scapula is caused by which of the following nerve injuries?
Long thoracic nerve.
Right. Which structure initiates the reflex that increases heart rate when baroreceptors detect a drop in the blood pressure?
SA node.
Wrong. Medulla. What adaptation in the respiratory system primarily enhances oxygen diffusion during strenuous physical activity?
Increases PO2.
Which physiological response results from an increase in carbon dioxide levels in blood?
Hypercapnia.
Hyperventilation is the answer. Which muscle is the most powerful forearm supinator?
Biceps.
Right.
Biceps.
The training program, which is conducted at intensities more than VO2 max with the work bouts typically lasting 30 to 90 seconds, is known as?
Anaerobic training.
Which type of joint is characterized by its ability to allow movement in multiple directions?
By ball and socket joint.
Right, and your time
synovial
is
joint.
up. Your time is up with this. Okay, it
Yes,
was an
ma'am.
extremely close scoring by both of the teams. So we have team B to be at 60 points. Congratulations, team B. And we have team C to be at 65 points. So congratulations, team C. All are the winners. I can see all the joy. So team B is our runner-up and team C is our winning team. Heartiest congratulations to team C and as well as congratulations to team B.
Congratulations, guys.
Congratulations.
Thank you.
Thank you. Thank you so much.
Thank you, ma'am.
Thank you, ma'am.
You're welcome. Just give me 1 minute. On behalf of Sancheti Institute for Orthopedics Rehabilitation College of Physiotherapy, I would like to thank our chairperson, Mrs. Manisha Sangvi ma'am, for giving us this opportunity. Our principal, Dr. Apurva Shimpi sir, for his constant support and encouragement. I would like to sincerely thank all the participating colleges for their enthusiastic participation in the quiz. Our technical team, Dr. Venu Mohan sir, Dr. Amruta Igbote ma'am and Dr. Mudita ma'am for making sure that the event is conducted extremely smoothly without any interruption. With this, I, Dr. Shavani Sutke, signing off from the PhysioBrain quiz. Thank you, everyone. Congratulations to Team C as well as Team B, and wishing everyone a very happy World Physiotherapy Day. Thank you.
Thank you, ma'am.
Thank you so much.
Thank you so much, ma'am.